Hello, I'm Dr. Prasanth Pillai. Greetings from the Smile Center India YouTube video channel. I just wanted to introduce you to the various aspects of gum disease. A lot of people have come in to our practice with gum diseases. So I just wanted to give you an overview of what needs to be done in the case of a patient who has gum disease. Now, what exactly is gum disease? Gum disease is a condition where the gums which are supporting the teeth. Now, as you can see in this picture, you have the gums here and the supporting bone underneath. So the gums are holding the teeth in its position and the gums are supported by the bone which you see here. So once the gums get diseased, automatically the bone starts receding. This is the problem. So I'm just going to give you a brief idea about how gum diseases progress. Now, this is the structure of the tooth with the supporting bone. So you have the gums here, and what happens soon after the cleaning, the tooth structure appears very clear and clean without any problem. But supposing a patient has not undergone cleaning, professional dental cleaning for quite some time, he develops some kind of a plaque around the tooth surface which is adjacent to the gums, and the gums become, because of the presence of the plaque, the gums start getting inflamed. Inflammation means the gums start becoming swollen and with a lot of increased blood supply, and this plaque can progress into the gum further down, causing recession of the gum. So this is what happens, and then finally the tooth becomes loose because of the loss of gum support, gum and bone support. Now let's see how the disease progresses. This is the cross section of a tooth which is depicted here. On the left side you have the picture, and on the right side you have the image depicting the situation of this particular picture here. So you have the healthy gum and bone, and once gum disease sets in the first stage you just have inflammation of the gum and the bone is not affected. But once the inflammation progresses to the base of the tooth, then what happens? Gradually it shifts to stage 2, where the bone starts getting affected and the bone gets eaten away. And finally, once this is not addressed, it progresses to stage 3, where there is a lot of bone loss, and very often the tooth becomes mobile and it can fall off. Now, please remember, at all these stages, the patient will never have pain. The patient will never experience pain. This is the problem. Now, most patients think that they need to approach doctors only when they have pain. And the sad part with gum disease is that they never experience pain. In most situations, they don't experience pain. They may experience some sensitivity, some bleeding gums and things like that. That's all what they experience. So this is the reason why we always say it's important that you go for a dental checkup once in 6 months, so that the doctor is able to evaluate you, and if required, do a proper cleaning. And during the cleaning process, all the tartar and calculus is eliminated and your teeth become healthy and your gums also become healthy. Now, in this picture you can see how gum disease progresses. On the left hand side, you see the deposits and plaque which is lying above the bone and above the gum. And on this side, you see the plaque which has gone down, deep down by the root of the tooth, and the bone is lost. So this is early disease and this is late disease. Now what happens in this condition? If you, on the left hand side, in this particular condition, if you get your cleaning done in a systematic way, then this plaque is removed and then the health of the gum and the bone is maintained. But when you don't address this at the right point of time, it progresses to a late disease when you have a lot of bone loss and the gums keep receding, and finally the bone is lost and the tooth becomes infected and you'll have to undergo an extraction of the tooth. So You can see this is in this picture, this is early gingivitis and at an early stage. So once you get a cleaning done, the deposits will all go away and the gums will turn healthy. You can see this, the patient has got a lot of deposits. All this have been removed and you can see the tooth has become healthy. There is absolutely no problem. It is bleeding slightly, but the bleeding will go away. Sometimes he will have to be taken up for one more sitting of cleaning when there will be no bleeding at all, and that's it. And then he will never have a problem. Now, in this picture you can see how the tartar has progressed deep down, and once the tartar was removed, you can see the root is exposed. So this is a very late stage in gingivitis, in gum disease. So if this patient had come earlier, we could have avoided this sort of a scenario. So I hope this image, from this image you're able to understand how bad, how to what kind of an extent gum disease can progress to destroy your teeth and gums. Now, in this particular video you can see this, how the tartar sticks onto the tooth surface, connecting all the teeth together. But then what happens? The tooth becomes mobile and it keeps shaking, and finally the tooth falls off. So this is a situation of very late gum disease. So there are people who ask me, doctor, what is the necessity to do a cleaning? I've seen that some people say that the teeth become mobile after the cleaning is done. Well, yes, that happens because the tartar is splinting all the teeth together, and once the tartar is gone, the teeth become mobile. It is only because you've not got the cleaning done at the right point of time. So once you get a professional dental cleaning done on a regular basis, such a scenario will never develop. So this is how the gum disease progresses. You can see the various stages of gum disease and finally how bone loss happens. And this is a situation where there is a very severe gum disease and the tooth necks are all exposed and it is very badly infected. I hope you have understood the fundamentals of gum disease. I hope you find this video beneficial. If yes, do share the video. Please press the like button and the bell button, and do subscribe to our channel. Thank you very much.